me as we go? Okay. All right, and welcome to class today, and this is functional soft tissue retrieval method for the posterior lower leg. And my reader today, Mia's going to read for me.
Starting on number 8.
Yes, starting at number 8.
So, medial to tibia, myofascial release stroke, addressing posterior muscles. Try again medial to that. Try a double-handed stroke, pulling down posterior lower leg to cover the whole muscle set. Get feedback if this area needs more work. Save time to address it with client in a prone position.
Okay, so now I'm going up the posterior leg. Now, I know that said pull down, but the whole idea of pulling down goes against the idea of working everything centripetally, which means pushing everything towards the heart. Because believe it or not, if we pull down, it affects not just circulation, but it actually affects lymph flow as well. Now, Harmon here elected not to have a bolster, and so when people don't have a bolster, you got to be aware that you're pushing down on the ankle joint itself. So what I'm actually doing is holding and supporting his ankle with my hand, so that it's not really pushing his, driving his foot down into the table. And then when I switch hands, I of course switch which side I support the ankle. Some people's ankles are just flexible like that. Not mine. I will get up off the table limping. Okay, Mia, will you read that part again where it says something about pulling upward? Pulling downward?
Yeah, try a double-handed stroke, pulling down posterior lower leg to cover the whole muscle set.
Okay, so like I said, the idea of pulling down, see, you already have gravity working against you. And so when you do that, stuff like lymph fluid and all that stuff, you can cause people's ankles to swell. So what I would probably do, and what I'm doing is I'm wrapping my fingers around and I'm pulling everything up upwards spatially. Or one of my favorite moves is I like to do it like this and use a C on both sides. And that way I'm getting anterior and posterior.
That hurt, Harmon?
No.
How would you keep the foot up straight? Because I wouldn't want someone's foot on my chest to hold it up.
Well, you could do it just like this. Now remember, if you got somebody who's got hairy legs, you might want to put just a tad bit of oil or lotion on your fingers. Because like I said, really all it takes is a drop. If you're dealing with somebody who's hairy, or you may have to use 2 drops depending on how hairy they are. So that's how I would technically do that move and cover all of the muscle tissue without pulling downwards. Okay.
MFR stroke from medial calcaneus up posterior to medial malleolus to tibial shaft, parentheses flexor retinaculum.
All right. So what I want to do is I'm kind of sculpting out the malleolus, carrying that stroke all the way up to the knee. actually working that retinaculum that's around this whole joint to help secure everything. Okay.
Stretch from medial arch up anterior to medial malleolus.
Okay. So when they're saying from arch, they're talking about coming from here. Okay.
Stretch from lateral calcaneus up posterior to lateral malleolus to tibia.
Now on this side of the, and I'm doing the same thing I did on this side, except right now on this side. And the lateral arch would be going that way. And again, I have his leg up in the air because again, he doesn't have a bolster, so I'm trying not to crush this ankle joint against the table. And it may not bother him at all, but I try to be mindful of what I like myself. Okay.
Stretch from lateral, is it calcaneus or calcaneus?
Yeah, calcaneus.
Calcaneus up anterior to lateral malleolus to tibia.
Posterior side of the leg, and I'm also coming off the calcaneus and going up the lateral side. And I even go up the medial side. Okay.
Make nice with gentle circles at malleolus.
Okay. And then there's that making nice. Okay.
Transverse, lateral, and medial arches. Work all three with thumbs. For transverse, try opposing thumbs going in opposite directions. Pull apart, push together.
Okay. So we're talking about. So what we're doing is kind of like this motion here. So we're pulling apart and we're spreading it, and then we're also pushing it together also. So I'm kind of going over the plantar surface of the foot, like so. And I go from the calcaneus all the way down to the ball of the foot. Okay.
Plantar fascia, broad superficial stroke on plantar surface with flat thumbs or loose fist. Do a few passes to cover entire surface.
Okay. So I'm doing 3 fingers right now. And you can see you can do a thumb. Or loose fist. Okay.
Deep intrinsic foot muscles, flexor hallucis longus, flexor digitorum longus, tibialis posterior, address more specifically and deeply along the line of metatarsals. Dig in with thumbs pushing from heel to toe. Stand and push from toes down to calcaneus. Again, several passes with specific tools.
What's next?
Pull gently on each toe. Visualize energy flowing freely down the leg, out each toe.
That little piggy went to the market. That was crazy. Wee, all the way up. Now, what's next?
Close at feet if needed. / time allows. Continue prone, working gastroc, soleus. Passive touch or rocking to tie the body together. Closing at shoulders can avoid putting hands from foot area onto head.
Yeah, that's so that you,
So your
yeah,
drums,
you know, because our feet, we walk on them. So
Yeah.
you don't want to
put them on
put them on the head. And then sometimes I will close out. So my thought is I'm lifting the soleus and the gastroc away from the bone just slightly, because you usually develop a lot of adhesions in this region here and on the lateral side of the tibia shaft. Or you can take and flush it all out like so. There you have posterior lower leg for the functional soft tissue retrieval method. Thank you.